Hey, how's everybody doing? Dr. Vaughn here. I get my little screen together. What the hell? What's going on here? Got my COVID-19. Hey guys, Dr. Vaughn, world famous bariatric surgeon. I want to talk about weight loss surgery and coronavirus. When can you expect to go back to surgery? What's happening with our surgeons and all that stuff. This is my med school diploma there, Texas A&M University there, and here is my certificate for graduating residency, Dr. Vaughn, General Surgery, Christus, 2005, yo. So I really am a surgeon. I am not practicing anymore. I have actually retired, and I spend most of my time, because y'all are asking what I do with my time now. I created an online experience, an online educational experience for the bariatric patient. Anyone who's trying to lose weight, get healthier, that's me. I am the bridge between the surgeon and the bariatric patient, the psychological, mental, emotional side. So why am I talking about coronavirus? It's simply because the #1 risk factor for coronavirus bad outcomes is morbid obesity. So that's why I'm doing this. So today I'm going to talk about what's going to happen with your weight loss surgery, maybe your program, if you have to do anything special for your bypass or your duodenum switch or your sleeve, or if you're thinking about having it. I'm also, if you will indulge me, tell you a little bit here about my weight loss surgery challenge. If you choose to join it, if you don't, no big deal. But it's basically a secret group of like-minded people who are just completely committed to seeing you succeed. You'll get a password to a secret Facebook group, and it's not like other things that you've joined before. This is me every single day interacting in the group, doing a Facebook Live, taking your questions, etc. In addition to that, you have an opportunity to join a group session. We meet weekly via Zoom, and we discuss our weight loss surgery challenges. And then in addition to that, if you really want to step up your game, you can get personally mentored by me. I won't handle your medical questions, but I will help you with your kind of life questions. And we meet once a week for that too. That's www.WLSchallenge.com, WLSchallenge.com if you're interested. So thank you for your patience, and I appreciate everybody who's on here. This is amazing. Go ahead and hit share. Let me say good hello to some people. Hi, Dr. Duck, love your channel. You're the best. Thank you, Brian Paul. I think you're pretty cool too. Check it out. Good day, Doc from Australia. Hey, Sam. Sam's in the challenge. Hope you're enjoying it. Is there a charge for your challenge? Yeah, you just go to WLSchallenge.com and check that out. Hey, D, how are you? I miss you, sweetheart. Hope you guys are staying safe. Twice in one day, you're spoiling us. I know, Shelly, this is my hard period. I got to get people in the challenge. That's the only way we can help them change. There you go. John Clark, he's in the challenge. He'll tell you how it's going. New Jersey Shore, Anna, take care. Be careful. Take care of yourself, okay? Hi, Christine Rose. How are you? All right. I'm only picking pretty pictures. Just kidding. Hi, Carrie. Happy Thursday to you, too. Where are you guys calling from? Clean Signal, Leander, Texas. Hey, Scott. Thank you for watching, man. I appreciate that. George, love that you give us real chat and science. Thank you. We're going to do a little bit of that today. Michael. Hey, brother. How are you doing? Yvonne from Pennsylvania is in the house. All right. San Clemente, California. Kelly Fox. I have never been to San Clemente. Hope it's cool. Ohio's in the house. There you go. Detroit. Man, you got to stay safe. Oh. London, UK. Hey, guests. How are you? I'm going to try to have my friend who's a surgeon there in London show up. Hey, Crystal Bell. Crystal Bell, how are you? Long-time follower, I believe. Cynthia Eggleston-Dales. You guys all follow Cynthia Eggleston-Dales right there. She's a certified personal coach and trainer. She's lost 150 pounds or so. Doing amazing. She'll do an amazing job for you. California's in the house. Hey, Christy. How you guys? All right. Everyone's kind of tired of that. So do me a favor. If I gave you a shout out, just hit share for me. We want to get some information out. Now, what I'm going to talk about today is also going to help you with your challenges also, even if you haven't had weight loss surgery. So don't think that this is just about weight loss surgery, because the information will also apply to you guys. All right. If you haven't had weight loss surgery. So here we go. Today is April 30th. We're at the end of April, and I'm Dr. Vaughn. I'm a world famous bariatric surgeon. I'm the author of 13 books. Here are my degrees, just so you know who you're getting your information from. I appreciate the shares and the subscribes. Why is a weight loss surgeon talking about coronavirus? The answer is because the #1 risk factor for poor outcomes if you catch COVID-19 is morbid obesity. Review of ICUs showed that 75 to 80% of patients who are on the ventilator in the ICU were morbidly obese with BMI over 40. So that's basically my following. Those are the people I'm trying to help. I am retired from practicing medicine. However, as some of you guys are keen to point out, I retired about 1.5 years ago, almost 2 years ago. And I now instead work with the bariatric community to help bridge the gap between the surgeon, here's the surgeon, here's the patient trying to understand these technical terms, and Dr. Vong is in the middle with all my books and videos. I have over 400 free videos on YouTube. So, you can, if you're a cheap bastard, you can watch on there. If not, you can join my community or, whatever you like, anything in between. I got anything from free books, free videos to top-notch premium high-end coaching. So whatever you need, I'm here for you. So I appreciate all the love and all the share. And let's talk about coronavirus. So April 30th, let me pull up the latest report. And I use the New York Times. I think they've been very good. We have over 3.1 million cases of coronavirus in the world and over 229,972 deaths. We are still pretty hot in Spain, Italy, in the UK. I know we have more cases and more deaths, but their death rate per 100,000 people is much higher. Ours in the United States is 19. We have 61,000 deaths, 1,100 cases almost. But the death per 100,000 in the United States is 19. Spain is 53. 53 deaths per 100,000 people in your population. So they have 24,500 deaths. Italy is 46. UK is 40. France is 36. So Europe's on fire. Now I've been talking about keep your eye on India. So India, when I first started looking at this, they were pitifully low. Come on, India. They only had like 150 cases when all this started, while the US was already over 10,000, 20,000. India had about 150. Now India is skyrocketing. They're up to 33,600 with over 1,000 deaths. So the death rate remains low. But remember, India is the second most populated country behind China. And unlike China, they are a democracy. So you can't issue military rule, even though they're trying to do a lockdown there in India. What we're seeing is the Indian numbers going up. They've passed Ecuador, Portugal, Switzerland, and they're about to pass Peru and the Netherlands. And then Belgium is another hotspot that rarely gets spoken about. There's 48,000 cases there and 7,500 deaths. Very high death rate. So that's about a 15% death rate off the top of my head there. And their death per 100,000 is 66. So much higher than the United States, Spain, Italy, etc. So Belgium is hurting. So all our prayers go out to these countries because we're all in it together. Yes. So I have a couple of topics I want to talk about regarding bariatric surgery and then coronavirus, and then I'll take some of your questions and I'll be able to do it like this. For example, I'll bring you on screen. Michelle Donovan wants to know, is this virus attacking because of lack of hygiene? No, unlikely. But it's always good to have wash your hands so you don't spread it. If you are in a high risk area, like you work at the hospital or nursing home, you really need to take off your clothes and shower, shampoo your hair really good upon entering your house. You need to take off your clothes and jump in the shower and bathe before you go around your house, if that makes sense what I was trying to say. But did it spring up like from poor hygiene, like the plague and stuff like that, where we had rats and shit like that? No. All right. So let's talk about bariatric patients real quick. Thank you for the shares, everybody. I appreciate that. What do you need to know? So a lot of patients want to know, Dr. Vong, am I at higher risk because I'm a bariatric patient? So my answer to that is it depends, because there's a couple categories, right? So how much weight have you lost? So let's assume that you've had weight loss surgery and you've lost a significant amount of weight, like 100, 150 pounds, and maybe your BMI is not normal. A normal BMI is 25 or below. But let's say you went from a BMI of 45, 42, and now you're at a BMI of 28, 29. So I would say that you've improved your chances of surviving coronavirus if you catch it, because we know that a major risk factor for poor outcomes with COVID-19 is morbid obesity, and you've dropped your BMI down now to, not that you're at your goal weight, but you're much better and you're much healthier. Hopefully with the weight loss, you've also had improvement in your breathing, because this is a respiratory illness, but you've also had improvement in maybe diabetes or high blood pressure, which we know is also a contributing risk factor. And so overall, your health would be what I would say is the general population, which in the United States is not so great, since we have a lot of obesity in the United States. Now, let's say you just had weight loss surgery and you haven't dropped a lot of weight yet. Let's say you're 1 or 2 months out from surgery. We call that the perioperative period. Then yes, your risk factor remains high as long as your BMI is still high, like I said, above 40. But think about this. Your blood sugars are probably better controlled now since you've had bariatric surgery, right? And even if you've only lost a few pounds, right? Those are lots of pounds off of your knees and your joints and also your breathing. So now your respiration is going to be better. Way to go. Good job. So even if you feel like you've only lost a few pounds, you're better off than where you were. Does that make sense? Which takes me to the last category, the preoperative patients. And let's say our average patient has a BMI of about 42. She's about a 40 to 50-year-old female. And let's say she's pre-op, and now she's kind of in a panic, because she's worried about, my surgery's been delayed or postponed. Dr. Vong, I'm gaining weight. What's going to happen? Yada, yada. First of all, let me just say you're going to be fine. Just calm down. Practice the social distancing. Wash your hands. Do all the stuff that we have been told to do, and we'll get through this, right? And we will pick up where we were. I mean, they're already making plans now in some states that have not been heavily hit, start doing elective surgeries again. So a lot of, Dr. Vong, when will we start doing surgeries again? I get that question a lot, and that depends on, one, what area you're in, how heavily hit was your area, your hospitals, your doctors, etc., and also whether or not, there's a comfort level, right? Like, how close are we to having this antibody test? So trust me, and this applies to everybody. When we open the world back up, we are going to have new procedures in place. There's going to be, you got to get used to possibly going to a restaurant and having them check your temperature. And if you have a little low-grade fever, they might send you home. Or they might ask you, do you have a cough or a runny nose within the last 7 days? And you're just going to have to get used to, if you want to go to that restaurant or that bar, to having a little bit of health information, shared. So when it comes to when am I going to have my weight loss surgery, Dr. Vong? Well, those are questions that we're trying to figure out. And you might have all those things asked of you to share and indulge, and they might run an antibody test. We don't have, they're working on the antibody tests. They're testing it. They're testing the test, and then we'll figure it out soon. So that might become a requirement of whether or not you get to have weight, or when you can have weight loss surgery. All right. Okay, so the next question I get asked often is, what about ibuprofen, Dr. Vong? What if I take, if I have a fever, can I take ibuprofen? And what about the ibuprofen with coronavirus? Somebody's about to comment like, oh my God, you're not supposed to take ibuprofen. Answer to that is chill out. Chill the fuck out. You'll be all right. I have a cough. I'm dying. Drink some water. So let's talk about ibuprofen and coronavirus first, and then we'll talk about ibuprofen and the bariatric patient. There's lots of myths around both. So there's no definitive data that says that you can't take ibuprofen with coronavirus, or if you have suspected fever and chills or whatever. That is a supposition that somebody blurted out on the internet, a public figure, or in the early days, and it just has kind of stayed in the common knowledge. And with all the fear that was going around, the CDC just said there's no data, but you probably shouldn't take it, but even though we don't really know. So the answer is, if I thought I had a coronavirus, I would have no issue taking ibuprofen. Of course, I'm not giving you medical advice. You decide what's right for you, call your doctor. But we don't really have any conclusive evidence that taking ibuprofen is going to somehow hurt your outcome with coronavirus. Your obesity, now we know that for sure, is going to hurt your coronavirus outcome. Which then takes me to the question about Dr. Vong. Bariatric surgeon patients aren't supposed to take ibuprofen or NSAIDs. That's not true. I know that is prevalent in the weight loss surgery community, but it's just not true. So the early data about NSAIDs came out of the gastric bypass population. And what they found was an increased incidence of stomach ulcers if you've had a gastric bypass and NSAIDs. Well, shit, duh. I mean, you made your stomach pouch this big, the size of an egg. And and you're operating on a patient population that has joint pain and chronic arthritis and are often used to taking NSAIDs like ibuprofen and stuff like that for their arthritis. So now you've got to make their stomach this big, and they're taking these ibuprofens and NSAIDs as they're losing weight. Of course they're going to get stomach ulcers, because we know NSAIDs as a side effect causes stomach ulcers. So in anybody, so even if Dr. Vong, even myself, I don't have a weight loss surgery, but if I chronically took NSAIDs, I would get stomach ulcers eventually. That's a known disease. In fact, it's known so much that we learn it in med school and residency, and it's actually described as a type of ulcer, NSAID-induced ulcer, stomach ulcer. So, of course, if you do a bypass, you shrink somebody's pouch, they take chronic NSAIDs, of course, they're going to have stomach ulcers. Now, the interesting thing is that actually came from studies that looked at stomach ulcers and combined NSAID use with smoking. See, no one ever talks about that. But actually, a much higher risk of causing stomach ulcers in bypass patients is smoking, poor healing, etc. So, but you never hear anyone up in arms about smoking. And yes, there are bariatric patients who still smoke, even though they stopped it, or my program required you to be nicotine free before surgery. But I'm no dummy. I know some patients go back to smoking. That's just the way this world works. But they're all up in arms about don't take NSAIDs. You have the NSAID police. Comment if you know these bariatric groups that are NSAID police, and they want to stand firm. Like, I didn't think you were supposed to take NSAIDs. Like, chill out. You'll be all right. If you have a little headache, pop an ibuprofen here or there, you'll be fine. It's the chronic use that puts you at much higher risk. Same thing for sleeve patients. So let's fast forward. Dr. Bone, what if I have a sleeve? Well, the answer is the same. You can't pop it chronically. All right. Okay, so let me move on to some new stuff for you. There's all sorts of hot shit talk about a drug that came out that's being tested. Remdesivir is so new that I even misspelled it on my broadcast yesterday. This is the proper spelling, Remdesivir. It's an antiviral. Now, before you guys get all hot and bothered about remdesivir, let me just tell you right now, it's an antiviral drug that is not approved for use in any disease anywhere on the planet in any country. It is completely a test drug. It has no approval for anything. So about a month ago, everyone became Dr. Google once they heard hydroxychloroquine. So they started saying hydroxychloroquine and Z-Pak. Yeah, they say Z-Pak because it's too hard to say azithromycin. But see, those are drugs that have been around a long time. Hydroxychloroquine has been around a long time for treatment of malaria, and at different doses, it's good for things like lupus and arthritis diseases and, you know, these autoimmune diseases. Turns out it's good for, which is weird because it works on a replication process for a parasite. That's what causes malaria. It's a parasite, actually. And so they started trying to use hydroxychloroquine on patients with coronavirus. And I'm thinking it in my head. And Z-Pax is an antibacterial that also disrupts using the DNA RNA synthetase to duplicate itself. It disrupts that process. So I was thinking, well, that doesn't make any sense, because if somebody's body is overwhelmed with coronavirus and you're sick because of cytokine storm, because your body's overreacting, and you know, I did that video about how coronavirus kills you with ARDS. Well, at that point, it's not the coronavirus that's the problem. It's the cytokine storm. So I don't see how giving someone hydroxychloroquine and Z-Pak is going to help with that storm. And if anything, you need to take it early. So if you don't take hydroxychloroquine either as a preventative or very early in symptoms, it's probably not going to help you. That's my thinking. But everyone's like, no, Dr. Vong, no. If I was sick, I would want it thrown at me, blah, blah, blah. And so guess what? Here we are 6 weeks later, and they are saying hydroxychloroquine and Z-Pak does not work. In fact, not for coronavirus. And so the CDC actually took that off their website. They took off their website, and they are sticking to the proper story of there are no treatments for coronavirus at this current time. And that's what's really troublesome. Okay, one last thing, and then I'll move on to your questions. Dr. Vong, when my doctors say it's okay to have surgery, is it safe for me to have surgery or procedures or colonoscopies or EGDs, right? And the answer is possibly. So what coronavirus has taught us is that we need to do a lot better job of cleaning shit down. So trust me, when these hospitals reopen, these centers reopen, they're going to be very hyper vigilant about cleaning down surfaces and really wiping it down, and not just a quick brush over. You'll see the same thing in restaurants. Have you ever been to a restaurant and the busboy clears the table and he just takes this dirty rag? He wrings it out and he wipes it all over the table, and then you sit down and like your table is stickier. Like, oh. So all that shit's gonna go away. They're gonna have major procedures in place where they're really cleaning the surfaces down really well. They're gonna be really wiping down the handle rails and the glass and the entry doors and all that sort of stuff. And they're gonna be very hyper vigilant about checking visitors in and out, and you know, probably not allowing people to sit around a waiting room. Or if they do, they'll be doing a social distancing sort of thing. And by that point, we'll have a much better understanding about what it means, the risk to the healthcare worker. Because I'm going to tell you, anesthesiologists are getting hit pretty hard. Because in order to put someone to sleep, an anesthesiologist, right, to intubate them, you have to get right up next to somebody's face to do that. And we know this is a disease in our lungs, and we know we have asymptomatic carriers, and we know that we have surgical cases where the patient is fine when they come in for surgery, or they don't have any symptoms. They had coronavirus, but they didn't have any symptoms. So then we do the surgery, and then they have a hard time recovering after surgery because their coronavirus flares up and they become very sick. And then the healthcare workers got sick from that patient too, inadvertently. It's nobody's fault. We just didn't know. These were the early days I'm talking about. So now that we know that, they're going to be prepared. So they're probably going to do some sort of really serious control. The doctors will gown up like in a full protective gown and N95 masks and everything. And a lot like what the orthopedic surgeons do to keep your joints nice and sterile when they're doing something like that. They'll probably start with simple elective outpatient surgeries. So nothing that requires an overnight stay. So even sleeves, like I don't think they would do like a 24-hour stay. If it's under 24 hours and you can write the discharge orders, that's considered outpatient surgery. I think they're going to clamp down on that. So you're talking about very little lumps and bumps sort of procedures, colonoscopies, EGDs, things like that. Some gallbladders, some people try to send home gallbladders the same day. I think that's a lot of pain. Common if you had your gallbladder out and it was really painful, and they might have kept you overnight. And even then, when you got home, it was pretty tough. Some hernia surgeries go home the same day, things like that. Some people want to know about dentistry, and the answer is that I'm not real sure, because with dentistry, you're dealing with right here where the bacteria lives. And so that's actually probably a good segue to another question, which I often get, like, does drinking lemon hot water and vinegar and stuff like that, will that kill the coronavirus? And the answer is most likely not. No, not really. So, all right, I think that's all I wanted to say. Thank you for your patience. Let me take some questions from you. Here we go. All right. All right. Thank you guys for watching. I appreciate that. So Charisma. Hey, Charisma. How are you doing, sweetheart? Stayed 3 days when your gallbladder was taken out. Yeah. Sometimes it can be hard. Yeah. Discoid, lupus, plaquenil. There's a lot more chance of getting. Nope. Maybe. Answers we don't know, because Tina, the honest answer to this is we just don't know the effective dose. We know the dose of Plaquenil, and for those who don't know, that's hydroxychloroquine. We know the dose to help treat your lupus, but we don't know the dose that it would take to fight off or prevent coronavirus, if that makes sense. All right. Could you address that study from England, please? Hey, Walter, man, that's a cool, sharp-looking suit, if that's really you. I'm not sure which study you're referring to, if it's that NIH study that was, there's been a lot of studies out of England, so I'm not really sure which one you're referring to. All right. What do they mean when they said that obesity increases risk of death by 37%? It increases your risk by 37% if you catch coronavirus, man. It's a major risk factor, buddy. All right. Oops, sorry. Jamie, they asked me to come in May 5th for my sleeve overnight stay in, is that New Hampshire, NH? May 5th, boy, that's pretty stinking early. Jamie, I mean, that's the conversation you need to have with your surgeon and your team, and how comfortable they feel. Were they hit hard, not very hard? Do they have any cases in the hospital currently? How do those patients look? How comfortable do you feel, right? Because these are gonna, and are they using the same ventilators? Sometimes, these are all questions that matter. And, like how badly do you want the sleeve, or would you be better off like just chilling at home for a little bit? Don't stress eat, don't gain too much weight. Carol Baker, when I had N1H1, also known as the swine flu, 2 weeks before that, I had cardiac stent pin in and almost died. Yeah, that's tough. I'm glad you're here. Almost died, right? But every day is a blessing, Carol, and I'm glad you're here. I'm glad you made it through. And yeah. Robin, longtime follower, and she's in the challenge. So, if you guys will pardon me, let me just use this second to talk about my weight loss surgery challenge. It is open now if you want help. It's not just for weight loss surgery people, but if you're interested in doing it, I only open it once a month. It's a secret Facebook group. You get a daily Facebook Live from me, helping you through the mental, psychological, emotional mindset required for surgery success, weight loss surgery success. But it really applies to anyone who wants to get healthy and lose weight. So you don't have to have had weight loss surgery. You don't have to be post-op or pre. I'll take you. And you also get a daily email from me with tasks and things to do. So let me take Robin's questions here in a little bit. I'm going to put that. It's WLSchallenge.com if you want to check that out. What about the ventilators they are talking about from China that are killing people and made to use in an ambulance? You know, I hate to say it, I just don't believe anything out of China. I know that probably sounds terrible to say. Maybe it doesn't. I don't know. But oops, let me put that back up here. But you know, they're a communist state. I came from a communist country, from Vietnam. And you just can't believe the information that's coming out of there. Now, we all pretty much know that the Chinese data is probably not trustworthy. In a city of 10 million people, and you have 88,000 cases, 82,000 cases, whatever the number is, and 3,400 deaths or whatever. And look at the rest of us. Same thing with Russia. Have you guys been following the numbers out of Russia? Do you really believe that death count? I mean, think about that. So, okay. Can you type the weight loss challenge in Facebook? Yeah. I think you saw that. Yeah. Oh, Carol. Yes, me also. Your cheeks look fuller. Stay at home. Let's put weight on you. Thanks, Carol. I've been retired almost 2 years, and yeah, I gained about. I'm up 6 pounds. I was up 15 pounds. So I've lost about 9 pounds. Are you building an immunity to this virus? Are people building an immunity to this virus or not? Janine. So if this virus, good question. If this virus behaves like any other viruses that we've all been exposed to, then the answer is yes. So you should build an immunity to it. If you've been exposed to it. Now, how long are your antibodies going to last for? Well, that depends on a couple of things. One is the virus, and two is the host. So by the virus, I mean, how stable is it? Is it changing all the time? Like HIV/AIDS? We've had HIV/AIDS since the 80s. So let's do some Asian math here. That's 80s, 90s, that's 40 years, right? And we don't have vaccine for HIV/AIDS because the surface proteins keep changing. But we've had a vaccine for chickenpox and smallpox for a long time, and those are eradicated because they don't change. So one, there's the virus. So there's the virus. So does it change? And then also, like, how big of a load did you get? Like, how big was your hit? Were you making out hot and heavy, like with somebody who was asymptomatic and you didn't know it? And you're making out like that, like hot one night, you know what I mean? Like Dr. V style, you know what I'm saying? Or were you like just happened to walk by 10 minutes after someone there coughed and sneezed and there were a couple of droplets? So there's the inoculation load. And then there's also the host. So you. Are you healthy? Are you young and healthy? Do you have a strong immune system? Are you on medicine, or are you on medicines that are designed to suppress your immune system, like steroids, for example? And a lot of like autoimmune disease stuff, Humira, for example. Have you ever seen the Humira commercial? And they say, take this for your rheumatoid arthritis, but let your doctors know before you have any procedures. We always keep take people off of their Humira and such similar drugs before surgeries because of the immune system. So the host factor, I keep using the wrong side. So the host factor, right? Who's a host? Are you young and strong, or are you older? And you have comorbidities. Are you on medicines? Are you a smoker, right? Are you morbidly obese? Yes. How strong is your immune response, right? So that's a good question, Janine. We just don't know how long your immune response will last to this virus, which is the question about the vaccine. So if they come out with a vaccine, would you take it? So let's take a poll real quick. If they come out with a vaccine against the coronavirus, against this coronavirus, right, this SARS-CoV-2, would you take it? So put a 1 in the comment section if you would take the vaccine. Put a 2 if you would not take the vaccine. You'll be surprised at how many people will not take vaccines, which also begs the question, hey, where are all the anti-vaxxers gone? What do the anti-vaccination people believe now? Are they going to take the vaccine for SARS-CoV-2 or not? Good question. Look at all these 1s and 2s. 1s and 2s. Lots of 1s, a few, but look, surprisingly, there are a lot of 2s who are like, I'm not going to take it. So I'm just going to tell you, I'm young and healthy. Danny took a 5. So I'm young and healthy. I don't take any medicines on a regular basis other than a little ibuprofen here and there and some allergy pills because I got allergies. But for myself, I probably won't take it. You know, honestly, I probably already had it. So I'd probably rather just take an antibody test to see if I have antibodies to it and go from there. And yes, I know I'm 47. I am 47. Look, comment, go, damn, if you didn't think I was that old. I'm 47. Thank you for all the dams, by the way. And but still, I'm healthy and I have that third world immunity anyway. So I probably won't take it. My girlfriend's 28. I know. Give me another damn, because my girlfriend's only 28 and she's healthy. And so I don't know if she'll take it or not. I don't know. All right. All right. Damn. Look at all these dams. Thank you. Okay. They want to chip us. Girlfriend damn. I know. Hot damn. Look at all this. So funny. Here we go. Here we go. We'll do all the dams. Damn. 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 All right. There we go. Awesome. I love it. She's damn lucky. I'm damn lucky. Yes. Thank you. You're still waiting for the F-bomb? I'm sorry. I'm sorry. You know. Damn, doctor. There are lots of dams. All right, give me a question. Okay. Why are you so happy right now? You know, it's really interesting you should ask that. Thank you for noticing. I'm generally a very happy person, probably because I retired and left surgery. But you know, like I've been really focused for the last couple of months about building my WLS challenge program. And this week I do a daily Facebook Live, but patients can also, the attendees can also opt to have mentoring with me or weekly group sessions or weekly group sessions. And these group sessions we hold on Zoom, and there's no more than 6 people. And I've had a lot of fun doing the group sessions. So, and this week was I thought was a really powerful one. So if you're in the challenge right now, there's a lot of people watching in the challenge. If you're in the challenge and you're in group, if you paid for the group option, comment, what did you think about group this week? Was it great? Was it mind-blowing? We did a lot of crying. I cried a lot during the group session. And so there are a lot of truths that just come out when we do group. And it's not therapy. I mean, right, guys? We're getting shit done, and it's really, really good. I'm 59, work out and eat right. I should be okay, right? Don't take pills, slightly leak your heart. They say 60. I think you're doing better than most, but you gotta be careful. Take care of yourself. Can COVID present as 2 weeks bad diarrhea and headache, pathogen screen negative? I'm 9 years post Roux-en-Y. Most likely not. It's 2 weeks of bad diarrhea and headache. Yes, so coronavirus patients can present with GI symptoms. Possibly, if you've been screened negative, I would get rescreened again. Usually we like 2 negatives if that's possible, but not always. I'm happy because she's 28. Thank you. Am I at greater risk complication for COVID-19 because of my hypothyroidism? Oh, I keep forgetting to answer this question. The answer is probably not. And so you phrased it really well. Thank you. Is that Shanice? I hope I'm saying that right, Shanice. Am I at greater risk of complications of COVID-19? So we don't have any studies to show that. It's not, last time I checked, there wasn't as high of a correlation with hypothyroidism when compared to things like obesity, advanced age, hypertension, and pulmonary issues. Those are kind of like your big ones. But overall, as long as your thyroid is controlled well, you should be good. If your thyroid is off, and you know when your thyroid is off, then everything's going to be off. You're going to be off balance there. So you definitely want to get that checked out. Take care of yourself for sure. Oh, I love it. Roxanne Baca, we're going to do a conspiracy question. Do you think COVID-19 is created by the government? If you had asked me this 2 months ago, I would have said, no, it came from bats. The more people I interview, the more videos I watch on YouTube. Don't do that, by the way. I'm pretty confident now that at the very least, I hate saying this, but at the very least, China probably let it get out once they saw what it could do. Did they knowingly make it in a lab? So it's easy to isolate a virus and then manipulate it in a lab. I don't know if it's easy, but it's possible. Or select out certain qualities of a virus. I don't want to think that way. I want to believe in the good in people. I know there are bad actors out there. I know not everybody wants to see us succeed and thrive. But where I come from and what I believe and whoever created me, I believe we live in a kind and good world. And there's plenty to go around. There's plenty for all of us to be happy and healthy and wealthy. And a second dose of happy. Much needed today's world. All right. Kathy, do you think we will be able to go out in August? Depending on where you live, yes. So a lot of states are starting to open. Supposedly, Texas is supposed to open up some parts starting tomorrow, May 1st. And we're just going to have to watch very carefully if it spikes up or not. So. Oh yeah, I watch Valuetainment. Have good conspiracy videos interviewing doctors if you want to check it out. I watch Valuetainment a lot, and I was actually contacted by Valuetainment to be interviewed, and I think I'm going to decline because while I like watching it, I just feel like it's gotten a little bit like sensationalism and ratings kicker. So. Steve Anderson, given how easily it spreads, I would go with poor lab practices, let it out, but it really came from bat with few changes along the way. I don't know if anything's real clear at this point, but I'm glad you believe that. Do you think it'll be back in flu season bad? I do. So Robin, if it behaves like any other virus that that causes flu-like symptoms, that's Corona. Corona does that too, as well as influenza. So it'll be back. It likes cooler weathers. We know that it doesn't like hot weather as much, hot surfaces. Now, don't go boiling shit. Don't go sitting in a sauna. That won't kill it. But we know it doesn't like to be in direct sunlight on hot surfaces. But it will be back but it's not going to be worse. Probably won't be worse in terms of, did it mutate into something, a stronger strain? Probably not. But it will be more difficult to manage because we will also be in the height of the seasonal flu. So, and they are very similar symptoms, man. You know, fever, cough, chills, headaches, body aches. I mean, that describes both COVID-19 as well as seasonal flu. So you're going to have a situation where you could possibly overwhelm the system, which takes me, I saw a question earlier about herd immunity. Will we have enough herd immunity? Well, probably not. You need about 70% of the population to have some form of immunity, whether it's natural, like I caught it and got better, versus I have a vaccine that I can vaccinate to 70% of the population. Because as you know, not everybody takes the flu virus or the flu vaccine. So, and herd immunity is where there's enough of people, usually younger people, that have antibodies or resistance to the virus, to the disease. And so that virus can when it gets into that host, it dies. It technically doesn't die. I get that, but you know, it doesn't spread. It doesn't replicate, whatever you want to say. So it kind of stops right there in that person. And the 70% who have immunity protects the other 30% at risk who don't, because it doesn't spread. It's kind of like when you're building a campfire, you know what I mean? Like sometimes you start a little fire here in this one side and it dies out. And then sometimes you try to start a little campfire and catches on. So herd immunity is this first scenario where it starts up in a little spot and then dies out. All right. Thank you guys so much for sharing and doing all the questions and comments. I appreciate that. I've already answered that. So the answer is no. All right. Eileen, conspiracy, you're trying to kill us off baby boomers. No, it's not. It's not enough. You're not going to have enough. I know these people that talk about this is an attempt to kill off population control, whatever. It's not. Listen, guys, I mean, 220,000 deaths worldwide, 60,000 deaths in America. One death is too much. That Trump says that, and that's probably the only thing I agree with him when he says one death is too much. But we have 7.5 billion people on this planet. The Spanish flu of 1917 lasted somewhere between 2 to 4 years, possibly, and it could have killed 200 million to 300 million people. 200 to 300 million people died worldwide over the course of several years, 2 or 3 years. Sorry, I'm about to sneeze. And we think it killed 200 to 300 million people. And yet here we are, 100 years later, the most dominant species on the planet, leaving a lot of death and destruction. And anyway, so no, I don't think it's a conspiracy for that. All right. I do have allergies, I know. All right, guys, thank you so much for watching. I appreciate that. I can't make this go too long just because I want to edit this down and put it up on YouTube. I haven't done my other ones. I did one yesterday and he put it up on YouTube. So I would appreciate if you guys checked out my WLS challenge. You don't have to have a weight loss surgery to be in it. You can be pre-op. You can be just heavy, overweight. You want to lose some pounds. I promise you what we do there is more of the head stuff, mind stuff, psychological, emotional stuff. I'm not going to give you a meal plan. I'm not going to tell you what to eat. You can find all that stuff for free. We're going to do with the hard work, the mental, psychological, emotional side, right? You'll get a daily email from me that will give you specific things to do. It'll give you videos to watch. You'll have an accountability partner. That's the key, the accountability partner. Come on, give it up for your accountability partner. And then we have a secret Facebook group where I do a Facebook Live every single day. And I talk about the email that went out that day, and I give my insights in having treated thousands of people. And then we go on there and we try to institute those changes. And this month, you also have the opportunity to join in a weekly group session with small groups, 5, 6 other people. And again, it's not therapy, it's we get shit done, and group is amazing. Likewise, you can also, if you choose, you can have one-on-one mentoring with me. I'm not going to be your surgeon. I retired. I'm not going to be your doctor. I retired, but I will help you with your life. I'm more of a life coach these days. So I appreciate your time and attention. I hope you will hit share. Thank you for those who did hit share. And thank you. Let me say out some names. Piggy Mama, love you, Dr. V, love you. All right. Tarny, thank you for watching. Jade Jones, say hi, please. Hi, Jade Jones. How are you doing? Back to Tarny. Okay. Thank you, Sherry Hensley. Shit just gets done. Thank you, Lindsay, Trisha. Hey, Jane Ross. You're awesome. She's all the way from Australia. Founders people. There you go. Hey, Sue First. Hope you're doing good. Great chat. Thank you, Kathy. Hey, Beatrice, I recognize your name. Long-time follower. All right. What's up, girl? How are you, Sarah Harris? I miss you. Hope you miss me too. All right. So thank you guys for all the love and support. And I'll be back tomorrow with another sort of a Q&A talk and things like that. And there we go. I want to get my webpage up one more time. So you guys check it out. If you don't, that's fine. If you don't need help, that's fine. But if you want to be a part of a strong community that will help you with your weight loss journey, check out that link, WLSchallenge.com. And if it's right for you, sign up. If not, I'll see you for free here on my fan page and replays on YouTube. All right. Thank you guys very much. Appreciate y'all. Thank you for all the love and support. Y'all be safe, and blessings to our first responders and doctors and nurses and people in the medical field, the phlebotomists and pharmacists and lab techs and everybody who's trying to fight this disease. Thanks. See you later. Bye.